I'm here with Diego Velasques at the SEPA Congress 2019. Diego, you've just given a presentation on the surgical microscope, so I was going to ask you to summarize your presentation, but with particular reference for the clinician who wants to begin to use the surgical microscope and has fears about how he might have to train the hand to adapt to the new perspective and aspects such as that.
Thank you, Peter. That's a great question, and that is one of the biggest fears that we encounter when we are talking about change in general. And when we talk to clinicians and they are going to embrace a new technology, a new tool that is going to facilitate tremendously the work and improve their outcomes, there is an incentive, which is the final outcome, but at the same time, the fears need to be overcome before you embrace that. And it comes with any change. One of the things that I emphasize when I'm teaching our courses, when I'm sharing information with practitioners, is that the process needs to be adapted slowly. Yes. Everybody needs to go at the same speed, otherwise you're going to end up rejecting out of frustration this new technology, and it would be a shame not to do that just because of the multiple advantages that this tool can bring to your practice. One of the things that I talk about is, number one, start getting an experience and start working with basic things, basic movements, basic projects, basic tasks. And as simple as it is, just doing a full mouth probing using the microscope is going to be a fantastic, good immersion with that technology. And there is a process that I was sharing today in the lecture that you can start incorporating to your practice that is going to lead you to one day, as it is in our case in Michigan, to use the microscope for 90% of the procedures that we do on a daily basis. And I think the evolution needs to be staged in such a way that once you complete a task and you feel comfortable doing that type of procedure, then you're going to begin the second phase. And the second phase could be something as simple as perhaps a non-surgical procedure, where you're going to be delivering an aesthetic, you're going to be working with root planning, curettage type of procedure, something that is not too invasive. Something as simple as well as removing sutures that is not threatening to the practitioner or the patient, but it's going to start allowing you to get that hand-eye coordination under magnification. And of course, as soon as you continue to evolve, you're going to start becoming more comfortable with what you're doing in the clinical practice. However, it is very important that all these efforts are backed up by practices outside of the mouth, on the top of a bench, where you're going to be working with models. Models are simple as rubber dams. You're going to be practicing your suturing, your coordination of your hands. You're going to be practicing with vegetable models, a tomato, making some incisions on a tomato and suturing those incisions. And you can escalate that to three-dimensional models when you're going to be working with animal cadavers. And then you're going to be working with silicone models as well, that are going to give you that three-dimensional experience that is what you really need to transition to the chair when you're working with a patient.
It's very, very step by step.
Step by step.
There's also an economic factor for the clinician. How can they see the benefits of getting into this technology when there's such a cost?
That's a great point, Peter. You've done your homework, and I like that a lot, because it is one of the obstacles that we encounter. It is, of course, the price tag that comes with the equipment. But at the same time, when I was doing this, there are a couple of motivators, okay? And my main motivator was for me to become the best that I can become in my field. And I have been following practitioners that are performing at an exquisite level of excellence. And one of the common denominators is their microsurgical training, is the utilization of these tools. And that was a very big impact factor for me to be able to start getting together and embracing this technology, number one. But number two, an afterthought was the cost. For me, the cost didn't drive the decision. But when I started looking at the cost, and then I started looking at what was happening for me as a practitioner from an ergonomic point of view, and I started experiencing that I was not fatigued as I was before when I was using loops, that when you're working with loops, you're doing gymnastics around the patient chair, and that can be very taxing to the body. And if you're going to sacrifice the length of your production, or so your productivity as a professional, and you start looking at a tool that is not going to let you cheat, that is going to force you to adopt an ergonomic right position when you're working with a microscope, the investment in the years of production, it is probably very hard to put in monetary amounts, just because it is time that you're buying, and all that time is going to multiply and translate into productivity for your lifetime. So when I finish a day after doing 6, 7, 8 surgeries a day, and I go home like I didn't see one single patient because I feel so comfortable with my body, it has been worth it. But that was, as I said, secondary and something that I became to enjoy. And now, of course, I share that because I think it is very valuable. And I have, during some of my training courses, I have met practitioners that did not embrace microscopy like I did. I did it voluntarily. Some of the colleagues that I have met taking courses to train is because right now they cannot practice anymore because of their musculoskeletal problems that they have developed. And they are forced to start looking at technologies, working with this type of tool that is going to facilitate their work on a daily basis.
So the comfort benefit is absolutely...
Your health.
Yes,
your health.
Yes. Big question for anyone in dentistry.
Absolutely. Yeah. Worth investment.
Physical, mental.
Worth the investment.